Should we have a cheat day with our heart healthy diet? Now, specifically, I'm going to talk about the ketogenic diet here. This is Diamond Fernandez with the Heart Fit Clinic, your leaders in heart health. And today I'm going to talk about should we have a cheat day? I want to talk about this latest study that was done. It was a small sample size, but something to consider what happens. And so, with a ketogenic diet, really what happens is that in this study, it consisted of 70% of it, the diet was fat. 10% was carbohydrates and 20% of it was proteins. And what happened is that it's very similar to our ketogenic diets that we hear out there and see what's going on. And so with this study, what happened is that they kept these patients on this, or the subjects on this diet, the ketogenic diet, and then they reintroduced glucose to it. And so what happened is that they had, I believe it was 75 grams of glucose drink before, I think it was before and after a 7-day high-fat, low-carb diet. And really what happened is they were looking for inflammatory markers, and they're looking for the response to what blood glucose does. And what we found instead was that the markers in the blood were suggesting that the vessels in the walls were being damaged, and they were actually due to the sudden spike in glucose. And so it's actually not a good thing to do is with a cheat day. And so cheat days are no good. And that's really what I'm getting at with this with this blog post, is that it's okay to have these, you got wedding season here happening, and there's weddings to go to and all that part of it. But when you have these cheat days, to when your arteries are not normally used to that glucose rise, we damage the vessels of the arterial wall. And then of course that can be the process. Remember, arteries are a muscle, not a pipe, and then that can damage the responses to what happens there. So make sure that life happens, I get that, but actually having an established cheat day, especially with a ketogenic diet, can be a little problematic to the arteries. And of course, more research should be done in this area, but I saw this study and I wanted to share it with you because it's a very important one, especially with a sudden blast of glucose, especially when your arteries are not used to it. It can be a little bit more damaging. And of course, you're doing a ketogenic diet because you have diabetes or you have weight loss to lose or whatever it is, and you're doing it for all these health reasons. And then if you have that sudden spike in glucose, it can damage the arterial health. Anyways, talk all day long. Make sure you hit the subscribe button above, and look forward to helping you live happier, healthier, and longer.